Kazakhstan International Vectors program informs you about international relations, political opinions, economic solutions and social development. 9/10 of our happiness depend on health. Arthur Schopenhauer, German philosopher. How long will you live? The forecasts of the World Health Organization. 500 grams is already a person. How medicine helps to increase the population of the earth. Health is fashionable. Why the world has begun running in mornings. To live happily ever after. This is the dream of each person on the planet. But changes in the atmosphere or wars are not damaging for the lots of people. The majority is killing themselves. In today's world, 6 of the 10 dead people have left this life because of various non-communicable diseases. 3 due to infectious diseases, malnutrition and some states of pregnancy and childbirth, and 1 due to accidents and injuries. On the first place in the list of the most dangerous risk factors for premature death is high blood pressure, which is responsible for 13% of all lethal cases.
86% of deaths in Kazakhstan are due to 4 major non-communicable diseases. It is the cardiovascular diseases like infarction, it is brain stroke, it is diabetes, which is also causing other deaths, especially cardiovascular deaths, cancer and pulmonary diseases.
According to many scientists, good health can be formed by the state of the human environment and genetics and the work of the healthcare system. But not less than 50% of life expectancy depends on a healthy lifestyle. So the concept itself is a complex issue.
Healthy lifestyle is actually everything that we are doing. This concerns nutrition, what type of food we eat, how much we eat, how frequently. It concerns the physical activity we have in our daily life, how much we are walking, how much we are exercising, is it regular or not. It concerns issues like tobacco smoking. It concerns issues like alcohol use, but it is also concerning about the balance between work and rest.
The World Health Organization has developed several recommendations mandatory for all people living in the world, needed to maintain a healthy lifestyle. The first is giving up bad habits. Men in Europe die 7 to 10 years earlier than women due to smoking. The second recommendation is a balanced diet, when it is possible to eat fruits and vegetables 5 times a day, with a minimization of the consumption of red meat. And the third recommendation is the everyday physical activities.
When we are talking about physical exercise, this is one of the major recommendations, at least 30 minutes of brisk walking every day. 30 minutes of walking every day is, for example, the best prevention of breast cancer in women, which is today having a very high place among mortality of women in Kazakhstan and in the world.
There is no such a medicine called healthy lifestyle, but people always want a universal prescription. How to be healthy. WHO recommends eat less sweet, cook fish twice a week and reduce the amount of salt and oil in food. But many do not like these tips. We say to the population, eat 400 grams of fruits and vegetables per person on a daily basis. Many people object to it. What if I have a family of 7 people, meaning such person cannot afford 400 grams of fruits and vegetables for everyone? But we say, what is actually 400 grams? It is 1 apple, 1 orange, 1 tomato, 1 cucumber, and we constantly explain it to the population. At least 400 grams of fruits and vegetables one person should consume on the daily basis, be it a lunch or any other meal. From smoking and diseases caused by it, 5 million people die annually. The life expectancy of a smoker is for 20 years lower than that of a non-smoker of the same age. But if only saying how bad and harmful it is, no one will give up smoking. The National Center for Formation of Healthy Lifestyles in Kazakhstan is fighting smoking by other methods.
It includes a number of other elements, which is fiscal measures like increasing the price of tobacco, reducing its availability, especially to children, to youth who are trying to smoke. It is the ban of selling cigarettes to underage persons. It is also the pictorial warnings of health damages on the packages.
Although an ancient Greek physician, Hippocrates, was speaking about the beneficial properties of the food, vitamins were discovered only in the late 19th century. The Russian scientist, doctor and biochemist Nikolai Lunin found that in addition to proteins, fats, carbohydrates, mineral salts and water, food contains other nutritional factors necessary for life. In 1880, Lunin was conducting experiments on mice. Two groups of mice were taken. One of them, the scientists fed with artificial milk, which consisted entirely of milk protein, fat, lactose, minerals and water. These mice soon began to lose weight and died. The mice from the other group, who were given natural milk, grew up healthy and strong. Lunin concluded that it is impossible to ensure the life only with proteins, fats, sugar, salt and water. There are other substances essential for nutrition. It is of great interest to investigate the matter and examine their implications for food, he said. However, the scientific world did not take seriously the conclusion of the Russian scientist. Officially, the vitamins were discovered only in 1911 by the Polish scientist Kazimierz Funk. Kazakhstanis grow in number. How much has the birth rate increased in the country? Running through this step, how healthy initiatives increase awareness about Kazakhstan in the world. The World Health Organization has been fighting for health worldwide. One of its major achievements can be called the eradication of smallpox in the world. The last case was recorded in 1981. Today, the WHO has defined its priorities, such as struggling with HIV, tuberculosis and malaria, taking care of a safe pregnancy and adolescent health. WHO gives consultations to the countries in order to help them in the implementation of new technologies.
Another good example is good perinatal technologies, which means techniques which are reducing maternal mortality, which are increasing survival of even very small babies. For example, Kazakhstan today has a very good survival rate of babies which are born with even 500 grams.
Since 2008, in Kazakhstan, babies weighing 500 grams are considered to be children and obtain the right to life. Over the past 5 years, the survival rate among premature babies has increased by 1/3 and amounted to 60%. According to the Ministry of Health of the Republic of Kazakhstan, more than 1,000 children are born daily and more than 400,000 annually. Over the past 5 years, the birth rate in the country has increased by 3%. WHO is also helping the government to implement programs to promote healthy lifestyles. Among them are the programs for pregnant women and young parents. The National Network of Health Promoting Schools was established in September 2000. The healthy lifestyle and good nutrition is also being promoted in regular schools.
For example, we have just finished a mission on promoting health in schools, where we have reviewed Kazakhstan program on healthy schools, which is part of the WHO network. And we have agreed that more needs to be done about the food meals given to children in the schools. They have to be balanced, they have to contain more vegetables and more fruit, which is very healthy.
Different researchers refer to the concept of healthy lifestyle differently. Someone includes in it the quality of medical care, and some do not. But no one will deny that the level of medicine has a direct impact on health. During the period of implementation of the state program Salamati Kazakhstan, it was noted that the population of the country grew up to 17,417,000 people, with an annual population growth rate of 1.24%. The maternal mortality has been reduced by more than 2 times. The infant mortality has been reduced by 70%, and tuberculosis morbidity decreased by 43.5%. The growing number of chronic non-communicable diseases remains to be the major problem. Even today, their treatment costs account for more than a half of total hospital care budget of the country. And in the next 15 years, Kazakhstan's population is projected to increase to 21 million people, with the number of elderly people increasing from 7 to 11%. Therefore, the state seeks to prevent chronic diseases now and organizes preventive checkups and screenings of the population.
WHO recommends only 3 major screenings, which is a screening for breast cancer, screening for cervical cancer, and screening for colorectal cancer. These are screenings which are effective. Why? Because you can have a very simple test, which is not painful and not complicated, and it is relatively economically affordable, and it can detect a number of people in the pre-disease stage where treatment is possible and where the person after that becomes fully healthy.
The list of ongoing research in Kazakhstan today contains much more. To the 3 screenings recommended by the WHO are added the tests for detection of diseases of the circulatory system, cancer of the esophagus and the stomach, liver cancer, prostate cancer, glaucoma, hepatitis B and C. The national screening system will be further expanded. In order to improve it, a working group will be created with the assistance of the World Bank experts. In the future, it should improve not only the quantity but also the quality of the screenings in the country. For example, many clinics are already provided with modern ultrasound machines. At present, the visualization has improved much. This, at first, has a great impact on the quality of medical research. At second, new functions have been added, such as the improved 4-dimensional obstetrics image or certain automatic measurements, which in turns allow decreasing the working load of the doctor by 80%. Correspondingly, if earlier a doctor could have inspected only 10 patients for a certain period of time, today he or she can inspect much more people. The fashion for a healthy lifestyle has reached Kazakhstan. Today, it is a global trend. Statistics of the last year says that the majority of modern Kazakhstanis are engaged in wrestling, boxing and football. The popularity of the new power sport, street workout, is also growing. A lot of people are fond of running and someone even organizes large-scale events. For example, marathon called Kazakh TV-eng Ultra was held this year for the 2nd time. It was attended by over 500 people. We had the participants who especially have come here from Canada, and also there was a participant from the South Africa. At that, people come here not only as guests, but really mature sportsmen of different age come and take part in our marathon. We have even prize holders from the Czech Republic, from the US, and this year a representative from Russia has won, who has run actually 70 kilometers with the best time. The idea of the unusual marathon belongs to Vadim Vinokurov and his friend Timur Artuhin. They themselves are the participants of many competitions, and the idea was born during the preparations for the next start. There is a huge number of marathons with a twist worldwide. The participants of the marathon around Mont Blanc get to the start on the results of the lottery. Runners overcoming the Sahara Desert are carrying only 12 liters of water and decide how to dispose it. These 2 Kazakhstanis have conceived marathon with an ethnic overtone. Participants start at the Tamgali Tas and run across the steppe. We chose the route very carefully. What will be the right place to turn, why to turn here, which hill to run up or down, etc. Here we have very specific technical work. The big efforts also lie behind the markings of the running distance. As for example, in a difference to the city marathon, there are no streets and it is impossible to give a name to a certain route. This year, the organizers of Kazakh TV-eng Ultra Marathon were supported by the Kazakh Geographic Society. The race was also an excellent way to acquaint foreigners with the culture of the country and a perfect chance to make the running even more popular and Kazakhstanis more healthier.